Good morning. Welcome to the 6th Annual Mesothelioma Symposium. In the past, we've called this the lung-sparing mesothelioma symposium since we've been promoting lung-sparing surgery. But in the last few years, that issue has kind of resolved itself. So we're now just a mesothelioma symposium. So we've been looking primarily at identifying new novel ideas for treatment. And we're going to, the first session we have today goes over just some of the clinical data, and then we're going to move on to that to some other clinical things later in the morning, but then mostly talk about interesting new concepts for treatment.
Mesothelioma, though low in incidence, for all of us who live in port towns and in towns where there had been quite a bit of asbestos-related activity, it is a major, major problem, because while those activities may have ceased and may have ceased a couple of decades ago, their damages persist way beyond the disappearance of these industries. This is a patient who has pure sarcomatoid mesothelioma. This is one of my patients with a fairly large tumor over here between these arrows. And after 3 or 4 infusions of pembrolizumab, this area is not there, and I believe this big conglomerate may be reduced to just this. About a year and a half later, this gentleman is still receiving pembrolizumab and is doing actually quite well. He really has no symptoms attributable to the meso.
We're going to be talking for the next 15, 20 minutes about a relatively new concept. So you've heard about large-scale pharma-driven clinical trials of mostly small molecules or monoclonal antibodies. I've been working, for good or for bad, for the last 25 years on a concept called gene therapy. This is a mesothelioma cell, could be a lung cancer cell, could be a kidney cancer cell, and you have what's called a vector. A vector is a device that can deliver genetic material to the cell.
The first few patients we treated did in fact develop an immune response to their tumors. This is an example, a very nice example of a patient whose tumors were at these levels. So I don't know if you can see these, but there's tumor here. These are the 2 chambers of the heart and the tip of the liver, but there's tumor here, and after 3 injections over several months, the tumors had disappeared. This patient went into complete remission.
In the field of molecular biology and of genetics and of developmental biology, this picture is actually becoming something of an icon because it represents some of the really brilliant science that went towards understanding how genes determine who we are, how they pattern the early embryo.
And as alluded to earlier, a large umbrella problem is this idea of immune ignorance and tolerance, where even though you may have certain immune cells, well, first you have a large population of immune cells that doesn't recognize a cancer cell as a non-self cell or ignorant towards it, but you have immune cells that may initially recognize it as a non-self cell, but through multiple mechanisms become tolerant to it. And now we are geared towards understanding strategies to overcome immune ignorance and tolerance, and perhaps CAR T cells and T cell therapy is one way to do that.
And this is the picture that Dr. Hassan has showed at a previous meeting where there was a patient with quite a bit of disease before treatment. It did not get much better right after treatment, but this was result at 8 months.
So I'm going to just briefly talk about what I do is cryoablation, but basically we introduce needles or probes inside the lesion, and we create an ice ball and use that to destroy cancer cells. You already saw by some of the data Dr. Cameron showed that these mesothelial cells do respond pretty well to ice and sort of a sub-zero temperatures. And even though we were not aware of it right when we started, it really has shown that sort of a response in our clinical practice.
So these are some of the terminology that all of a sudden, you know, people get a life-changing diagnosis, and if they don't have a nurse navigator and they go see their oncologist or primary care provider or pulmonologist, whoever did the initial diagnosis, and they might hear some of these terms and not all of them. But as they go through and see other specialists, they'll hear, cryoablation, sarcomatoid, epithelioid, radiation, all this stuff that is really overwhelming, and in particular to someone who just obtained this diagnosis.
What I would like to do is to try to share with you some of my views about how to help patients going through the journey with cancer. I've been at UCLA 48 years, and so this represents some of my thinking about healthcare and how we need to kind of go back to the person. And because it's kind of very important that a lot of patients who are going through treatment with cancer are having a lot of symptoms, and that and many of the survivors also have a lot of unmet needs as well.
And the more specimens we collect, just as we spoke about earlier with UK Biobank, the more precise our research will be. There's a national system for the donation of organs, but not a national tissue bank for the donation of tissue. We received IRB approval to create an international tissue bank, and PHRBI developed the protocols for processing specimens, storage, and tracking, with the primary objective to collect health information and tissue samples from participants who wish to donate their tissue for future research at the Pacific Heart, Lung and Blood. And we have an agreement in place with UCLA to share their tissue. And our tissue bank is the first in this country that it's not limited. We will take tissue from patients of all types and share those with others. So both normal and diseased tissue samples are collected and placed into a database maintained at PHLBI.
The idea behind this is if anybody here wants to tweet it out or do anything else, we want people who may be in the middle of Wyoming and having a colon cancer taken out or a lung cancer taken out or something, instead of just leaving that tissue sitting in a pathology department for a number of years and being thrown away, we would like people to help us by helping to donate that tissue to PHLBI. And in the process, PHLBI is going to shoulder the cost of keeping everything frozen and space and all that kind of stuff. But if people can help with that, we can potentially get tissue specimens from around the world and have a really useful bank.